I worked with my member, Congressman Obey, on the Occupational Safety and Health Act, which it was creating that OSHA. Then it didn't exist, and it was highly controversial.
The big briefings were like on AIDS, because it was brand new. What's the testing? What's the research? What's the status? Where are we? What are the discriminatory policies? How do we deal with the influx of cost of a disease at that time that we knew very little about? So I worked a lot on research for AIDS. I worked a lot on reimbursement. How do we pay for these things? Because so many people that were infected didn't have insurance.
During the time that I was a fellow, 1993-94, healthcare reform was a major deal, so everybody was interested in it. And many different senators and members of the House had ideas that they wanted to put forward. Actually, the Administrative Simplification subtitle, I think, is the first law that was ever written using only a computer.
So my first job was to define what's medical necessity. Well, medical necessity turns out to be the thing that determines whether or not you get coverage, whether or not things are paid for. The second is that because I was a medical doc in the Senate Finance Committee, my job was to define benefits packages. And I'm like, okay, but then infants are very different from children. Children are different from adolescent boys and adolescent girls, and they are entirely different from adult men and women, and to say nothing of the elderly. So that was my job, to define those benefit packages.
Well, the major health policy initiatives that I worked on was really one of the first healthcare reforms. This was in the 90s, and this is well before Obama and Obamacare. We had worked, I believe it was termed Hillary Care, if I'm not mistaken.
It was after the failure of Clinton's effort at healthcare reform. So the feeling at the time is, let's see what we can do incrementally. They really wanted to focus on was expanding insurance coverage for children. The ultimate result was that there was money for expansion of children's health insurance. That was considered a big, big success at the time. I was also working on some end-of-life care issues.
I met with a lot of constituents. The senator wanted us to look into. The one that stands out in my mind is one day we were sitting talking with him about his health policy priorities, and he mentioned we should do something about this epidemic of childhood obesity. And in that particular year, the Institute of Medicine, as it was known at that time, had their annual meeting, which focused on childhood obesity. So I followed up on that, and we were able to identify some funding through the legislative process and then matched by the Robert Wood Johnson Foundation to fund the study for prevention of childhood obesity. So that was something that was not expected. And it was just a pleasure to have my small role in that.
You know, I thought I was going to come here and talk about coverage issues for poor or populations that didn't have healthcare coverage. You know, during the 9/11, post 9/11 time, it was like this really happened. I mean, you know, the horrific attacks on New York, what was going on overseas, domestic anthrax attacks are happening. And then, you know, suddenly we're also talking about issues of public health and rebuilding a public health system, rebuilding a surveillance system and a biosurveillance system, veterans issues. There's a balance between public health, these surveillance issues, these other issues, and our kind of usual forte of things that need to be covered or dealt with.
In my year, again, in 2002, prescription drug plan and Medicare was a hot topic. A program that was sort of near to me, and I do a lot of infectious disease work, was PEPFAR, one of the most amazing programs ever, in my view, ever put together by the U.S. government to support foreign policy. And then a number of things that I was able to work on related to biodefense in my time on Senate Health.
It was all about Medicare. The Medicare Modernization Act was passed that year. I had the opportunity to work on several aspects of that and even contribute to writing parts of the bill. What isn't remembered is that there was an opportunity for medical liability reform that year.
The Congress had just passed the Medicare Modernization Act, but that introduced Part D of Medicare, so a lot of it was working out details of prescription drugs.
I covered international health issues with a focus on AIDS, TB, and malaria. Mad cow came up. I'm not a veterinarian, but I was assigned that. But in general, most of the talk at that time, there was a lot about PEPFAR.
I ended up having the opportunity to do a lot of work on food safety and food policy. I worked on broadband and the healthcare implications of expanding broadband access, dental access, things that I had no idea about before the fellowship.
I got to work on some of the rulemaking that came out of CMS, and that was fascinating. I didn't know anything about that in my previous life. I got to work on some of the healthy food initiatives. I remember being in a room and part of the meetings where the Department of Agriculture and HHS were duking it out around what a healthy plate would look like and what colors we might use, but moreover, what the content of that was.
I actually led the writing of the legislation that turned into the funding mechanism for the Patient-Centered Outcomes Research Trust Fund. And there were other things that ended up in the ACA that we worked on as well.
I was part of the team where we were able to define how extra graduate medical education spots might be shifted from specialists to primary care spots. Part of that was in the Affordable Care Act. I got to work with the team that was partnering with the White House on Let's Move. I worked around implementation of many of the Affordable Care Act elements.
During my fellowship, the major health policy initiatives that I worked on, number one was prescription drug abuse. In addition, I also worked on broad aspects of the Affordable Care Act because it had just been passed. So there were some pieces that needed to be refined, if you will. We were still trying to gather support for some of those provisions. So those were the two main things that I worked on.
So some of the things we talked about in 2012, of course, the ACA had passed, so there were still parts of the ACA that had to be implemented, of course, right? There was the marketplace. So there were still parts of ACA that had to be stood up depending on how that election was going to come out.
I was there in 2014, which was the year that the Affordable Care Act was rolling out. I was in my placement when we were, when people were actually for the first time signing up for the Affordable Care Act health plans. We were watching that, tracking that, trying to figure out what was working, what wasn't working. I mean, it was a pretty unbelievably amazing time to be in that office.
So some of the key policies that I worked on was trying to alter the Public Health Service Act to better fund pandemic influenza, also to work on reauthorization issues, and I think really importantly, and civil rights issues. So at that time, there was an effort by the administration to undo some of the regulations that had been put in place by the Affordable Care Act. So there was an attempt to do that, and we really tried to stop that.
My fellowship time when I was there was at the very tail of the pandemic. There were big issues related to how would we be ready for the next pandemic. And there were also big issues for change in capping cost of insulin, Medicare drug negotiation possibilities. This was also the time of international treaties, particularly within the World Health Organization.
2021, we were still in the pandemic, but we were not at the beginning part, and we weren't quite at the end. And so it was this interesting place where folks were talking a lot about mental health, and they were talking a lot about how to better prepare for the next pandemic. We also had opioid. Lots of folks were concerned about the opioid crisis, which is obviously still exists.
We had the infant formula crisis, which was pretty astounding that a country of our caliber would have something like that happen. My background is maternal newborn health, and one of the first hearings I got to go to was with the secretary from HHS, and it was about Medicare reimbursement and the whole package. And during the hearing, Senator Cassidy turned around to me and said, "How many babies are born each year that are covered by Medicaid?" And I know that data point just because of the space I've always worked in. So it was like, oh my gosh, I really know something and can contribute here.